Like so many things, we take the skin of our hands for granted until something goes wrong. We go about our everyday tasks at both home, such as when preparing food, washing up, doing cleaning jobs and gardening, and also at work, with little thought about how we may be damaging our skin. The commonest skin problem to affect the hands is hand eczema. It's sometimes also called hand dermatitis. This can start as a minor itchy nuisance. At its worst, produces thick, scaly patches on the backs of the hands and the palms. The skin can split, producing painful fissures that may make even the simplest of manual tasks an ordeal. Hand eczema is also a huge economic burden, as it is the second most common cause for people having to take time from work. So how do people develop hand eczema, and what can be done to prevent and treat it? Hand eczema can be thought of as being caused by separate mechanisms. It can be caused by endogenous or internal causes, or by external or exogenous factors. External factors may act as either irritants or allergens. In practice, however, sometimes all three separate mechanisms are playing a role in producing hand eczema in a particular individual. Most people who develop endogenous hand eczema have suffered from eczema in infancy or childhood. This is referred to as atopic eczema. This often starts in infancy with red, itchy patches on the face and arms, and as time passes, it often develops in the crook of the elbow, behind the knees, on the wrists and ankles, but it may disappear by the age of 7 or 10. However, sufferers always have a tendency to developing eczema, and it may occur later in life on the backs or palms of the hands. Irritant eczema can occur anywhere on the skin, but it's particularly common on the hands because it is caused by repetitive exposure to irritant substances to which the hands are commonly exposed. Common irritant substances like detergents used to clean clothing, dishes, cleaning fluids, organic solvents such as white spirit, petrol and diesel, cutting and cooling soluble oils used in the engineering industry, shampoos and hairdressing chemicals used by hairdressers. We are all susceptible to irritant eczema if we are exposed to a strong enough irritant for a long enough period of time. Allergic eczema occurs when the skin is exposed to even small quantities of a substance to which that individual is allergic. Their immune system is sensitized to this chemical, and when they are in contact with it, they develop eczema at the sites of exposure. In people who are not allergic to that substance, even repetitive exposure will not produce eczema. The allergen causing allergic contact eczema can be identified by a technique called allergy patch testing, which is performed by dermatology specialists. Small amounts of allergen are applied to the skin on the back and left for 48 hours. A small patch of eczema will develop at the site of application of the offending allergen. Identification can then allow allergen avoidance, which will prevent the eczema recurring. People employed in some occupations are particularly liable to develop hand eczema. Common factors are repetitive exposure to wet work. Hairdressers, cleaners and caterers, healthcare workers, engineers working with cutting oils, construction workers are all particularly susceptible. Anyone who has had eczema in childhood should be aware of this as they choose their future career. So how do we reduce our chances of developing hand eczema? Reducing our exposure to irritants and potential allergens is key to this. Here are a few tips. When washing your skin, avoid soaps and detergent-based products as much as possible. Light moisturizing creams such as aqueous cream can be rubbed into the hands in place of soap and then rinsed off under running water and then patted dry with a towel. After washing, it's important to use a moisturizer on the hands. This helps to maintain the hydration of your skin and to keep it soft and supple. Try out a range of moisturizers to see which one suits you best. In general, there is a compromise between a greasy product being more effective and a lighter product being much more cosmetically elegant. The right one is the one that you like and the one that you will use. Moisturizers can be used as often as you like and need, but try to use always after washing the hands and at least 3 or 4 times a day. They cannot be overused. By lubricating and protecting the skin, this will help eczema to resolve, and continued use, even if the eczema seems to have settled, will help prevent recurrences. It's essential to protect the hands with gloves for both wet work and dry, dusty work. For wet work, such as washing up, washing clothes and wet housework, food preparation or cleaning the car, if possible, use a thin cotton or even a silk glove inside a waterproof glove made of rubber or vinyl. The inner glove helps absorb sweat and stops your hands getting moist as a result, but may make you less dexterous for some fiddly jobs. For long jobs, the inner glove can be changed from time to time for a fresh, dry one. Use gloves when using shampoo. Latex gloves are more prone to pull the hair, and vinyl gloves are often more comfortable. If you're working, your employer has a responsibility to provide you with gloves that give appropriate protection for the products that you're likely to be exposed to. Gardening can worsen hand eczema. Use a waterproof glove for wet work and a canvas or leather glove for dry work. Batch your work so that you're not constantly putting your gloves on and off. Cold, dry weather can make skin affected by eczema dry and brittle, and then bending the fingers and hands can produce painful splits. Ordinary gloves when you're outside will also help prevent this. If you develop hand eczema, you will often be prescribed topical steroid ointments or creams to use to help suppress the inflammation of hand eczema. They come in a variety of strengths, and your doctor will tell you if they were weak or potent. The skin on the back of the hands is very much thinner than that on the palms, and so we need to use stronger products on the palms and keep to weaker products on the back of the hands. If you only have eczema on your palms, try to avoid wringing your hands as you apply your steroids, as this spreads the steroid onto the thinner back of the hand skin. This will prevent the steroid inadvertently causing skin thinning and bruising over a period of time. So how much and how often should a steroid be used? At first, when the eczema is red, angry and active, steroids can be used twice a day. As the eczema begins to improve, the frequency of application can be reduced to once a day, then every other day, and then sometimes as little as twice a week. If the eczema relapses, the frequency of application can be increased again. Between applications of steroids, it's essential to continue to use moisturizers frequently and liberally. If hand eczema is proving more acute or stubborn, we have a few tricks that we can use to help. If the eczema is very thick, dry and cracked, or it is being scratched because it is so itchy, we can apply topical steroid creams or ointments and occlude the skin with either cotton gloves or a special creamy bandage such as Viscopaste, Ichthopaste or Steripaste. Look at the separate video for further details of how to use and apply these. Splits and cracks on the palms, fingers and knuckles can be very painful and allow infection with bacteria to enter the skin. A useful trick is to use a special steroid-impregnated tape called Helan over the cracks. Look at the separate video if you need to use this. Eczema on the palms can be very acute, and tiny, intensely itchy water blisters can develop. It can appear like loads of mini frog spawn or tapioca under the skin of the palms or sides of the fingers. The medical term for this is pomphalix. It can occur in acute self-limiting attacks, sometimes triggered by warm weather. A useful trick to dry up the blisters, stop them weeping and prevent infection is to use potassium permanganate soaks. Look at the potassium permanganate video to learn how to use this. With the correct investigation, hand protection, allergen and irritant avoidance, moisturizers and topical steroid treatment, most hand eczema can be satisfactorily controlled. If these measures fail to give a satisfactory response, then there are other treatments that specialists can suggest. We occasionally use short courses of steroid tablets to control acute, short-lived flare-ups of hand eczema. They are seldom a safe, long-term solution, however. In the last few years, a vitamin A-based tablet called alitretinoin has been introduced as an addition to topical therapy. It's used for 3 months and is particularly helpful for chronic, dry, thick eczema of the palms. About 50% of those who use it get at least 50% better, and the benefit may last for a useful period even after the treatment has been discontinued. An alternative to alitretinoin is a special type of light treatment called PUVA. A light sensitizing lotion called Sorolins is applied to the hands, and 10 minutes later, ultraviolet A light is shone onto the hands. This needs to be given in a hospital skin department twice a week for 8 to 12 weeks to get maximum benefit.